Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about constipation in infants and children. It's important to know that daily pooping is very good for health. Now, constipation is a common problem, and when it becomes chronic, it is very painful for the child and for the parent. Early diagnosis is very important. Firstly, to rule out any medical problems like hypothyroidism or problems in the spine or even Hirschsprung, or what is known as congenital narrowing of the anus. Apart from that, constipation needs to fulfill two of the following criteria: that there should be reduced frequency of stooling, passing of hard stools, pain during defecation, lump of stool palpable in the rectum, so the doctor can feel the stool in the rectum. And sometimes the child has involuntary passage of stools in their pants in already toilet trained children, and this is known as encopresis. So once medical causes have been ruled out, functional constipation would be the diagnosis, and this is often seen in the outpatient clinics and departments. The bowels of young children is very soft, and when there are large hard stools present in the rectum, it gets stretched. So it's like if you stretch a rubber band very hard, its elasticity is gone. Similarly, the rectum, when it's overstretched, stops working properly. The hard stool causes impaction, and defecation is painful. So then this is a vicious cycle because the child then withholds passing stool even more. As I mentioned before, encopresis happens. That means runny stool from the side of the hard stool that you see in the rectum can pass, and the child actually continues to stain his clothes. I've seen even school-age children having this problem, and it's very embarrassing and shameful for them. Also, when hard stool finally passes through the anus, which is the opening, it can cut the soft tissue and cause bleeding and even greater pain, and this is known as anal fissures. Now, functional constipation has three main features or causes. One is diet, allergies, and faulty toileting leading to behavioral issues. In this day and age, there is a lot of highly processed food being consumed by children at the expense of fruit, vegetables, and fiber. Also, in their busy lifestyle, time to sit on the pot or on the commode is shortened, or they're rushing for the school, so they forget, and this can lead to constipation. Cow milk allergy in my practice is one of the commonest causes of constipation in young children. In a study, 68% of children with chronic constipation improved on soy milk as compared to those who were not switched and continued to drink cow milk. And in cow milk allergy, the bowel becomes inflamed because of the allergy. Many times these children may have associated coughs, colds, eczema, and sometimes even asthma. Now, toilet training is a very major issue, and often parents are overly enthusiastic and try to start training too early, and the child is not developmentally ready. Now, 2-year-olds are actually very difficult, and they are known as terrible twos because they will do the opposite of what you tell them. This oppositional behavior is normal at this age, and when they are forced to pass stool, they may withhold it, and then the power struggle that ensues. I've had parents, they call up each other in the office and they discuss, has the child passed stool today? And often the child is screaming and crying, face red, and the constipation or habitual constipation becomes a big issue. So what can be done? The most important is to disimpact the hard stool, so remove the hard, and this can be done by the help of enemas, which is putting water from the anus so the hard stool gets softened and it comes out. Sometimes applying lignocaine jelly or a local anesthetic around the anus also helps so that the child doesn't feel pain. Of course, stopping cow milk and improving the diet goes without saying. The child can be given mild laxatives for around 10 days. Also probiotics, because those are very, very important for gut health. It's very important for toilet toileting to be a pleasant time. The child should not be made to feel uncomfortable or upset or threatened, and creating a habit of sitting on the toilet 2 times a day. I mean, they can play on their iPad or read comic books, but they need to sit on the toilet. Of course, drinking large amounts of water is also essential. If you're seeking help, please visit us on our website www.singhaniaclinic.com or call us on the number or email shown. Thank you.